From a clinical research organization CRO standpoint, the studies we administer go through a rigorous process of development, as is standard in the industry and with other studies we conduct for big pharma. There are two types of studies that we have conducted in regards to these vibrotactile haptic patches. The first are called observational studies. These studies involve subjects who are asked specific questions about their experience after using the studied patch. The questions asked are from validated scales like the Brief Pain Inventory, the Perceived Stress Scale, and the Pittsburgh Sleep Quality Index, for instance, that have been used in thousands of other clinical studies. It also should be noted that the FDA has provided guidance on the validity of these observational studies and the value that they provide in terms of getting a better understanding of real-world evidence. Over the past year, we have also conducted clinical trials that, in addition to observing the patient's response and asking about their experience, we have also incorporated functional measurements, like having study subjects wear a Whoop device that records all aspects of a person's daily activity and sleep patterns. We've also taken measurements in Division I elite athletes that are standard performance measurements. With the incorporation of these functional measurements, we can compare what the subject is saying they are experiencing with actual objective measurements. Let me talk now a little bit about the protocol development process. We first identify a principal investigator, such as yourself. These are clinicians that are experts in the field and have experience in the study, in the area being studied. Dr. Toker, Dr. Saker, and you, as you know, have all been principal investigators for these vibrotactile trigger technology super patch studies. With these clinicians who are selected, we then develop a protocol for comparing an active super patch with a sham or placebo patch. The subjects in the study are randomized and blinded, meaning that they don't know which patch they will be receiving. The protocol then gets submitted after completion to an IRB, an institutional review board, which reviews the protocol and methodology to ensure that the study subjects are protected and understand any risks from the medical devices that are being studied. For the super patches that we have studied, they are non-invasive, have no ingredients, and are considered a Class 1 medical device, the category with the lowest risk. In all the studies we've done for super patch, we've never seen a severe adverse event, and any adverse events that have been reported were minimal. The outcomes we've seen include, in many cases, a p-value of 0.001, and if you remember from stats class, that means that there is a 1 in 1,000 chance that the results are by chance. The results from the studies have been presented at over 20 international scientific medical conferences after peer review from the scientific committees and been published in many scientific peer-reviewed journals that can be found on Medline, PubMed, and other literature reference libraries. We have many other studies in the works right now. All of them can be found on clinicaltrials.gov, and we look forward to conducting those and really seeing what the outcomes of those studies show.